Hi, it's Dr. Greg Jantz. Triumph over trauma and hope and possibilities. The new book, it's all next.
Dr. Gregory Jantz is a best-selling author of over 45 books and the founder of the Center A Place of Hope, voted a top 10 center for depression treatment in the U.S. As the pioneer of whole person care, Dr. Jantz is known as the messenger of hope. Now the nation's expert on anxiety, depression, substance abuse, relationships, trauma, and PTSD, here is Dr. Gregory Jantz.
As a mental health professional now 39 years, it's amazing to say that. And I have authored, now this is going to be if you count the redos and all the books that we've done over time since 1992, Triumph Over Trauma is the latest. I have been passionate about how to recover from trauma. If there's one issue that's behind depression, behind anxiety, behind addiction, behind a lot of mental health struggles, it has to be unresolved trauma. Triumph over trauma. Here's what we know. What do we know about trauma? Trauma is something that is extremely painful. And it's something that we go through that, in fact, sometimes gets labeled post-traumatic stress disorder. Some like to say post-traumatic disturbance because some do not like to say this is a disorder. However it is, when you've had traumatic events and there's been perhaps significant stress and anxiety for a very long time, you're at a place, and the question is, how do I overcome this? How do I really deal with trauma in my life? And maybe that's not a label you give it. And maybe we say, how do I get over my depression? How do I get over my anxiety? How do I get over my post-traumatic stress disorder? It's really because we have to look at what's the root cause of all this. And as I dive into the root cause, I can begin to look at, oh yes, that early childhood trauma connected me to a lifelong pattern of depression, affected all my ability to have healthy relationships. And later on, I developed an addiction, and I have anxiety disorder, and I've done 5 or 6 different medications, and I'm still not doing well. But we never really connected it back to the beginning. And so when we look at, and let me just say, the last 3 years or a period of time that we've labeled pandemic has been a time for many, 70% of Americans say so, that it has been a time of significant trauma. And let me say, trauma leaves scars, and it can create deep, hurtful shame. It is a shame that just doesn't seem to go away. Shame says, there's something wrong with me, I'm defective. As we look at this, we want to look, okay, really, what creates this level of shame? What creates this level of pain in our life? And I made a list. One, I want to just say right at the top, sexual abuse. If you were a victim of sexual abuse, repeated sexual abuse, when you were young and over time, that today, that unresolved trauma could have affected your brain development, could have affected other physiology and even brain chemistries. Trauma on the developing brain does have an impact. It does change. We're incredibly resilient, but trauma affects the body physically and physiologically. Domestic violence. And domestic violence could be multiple events, usually it is, over a period of time. It could involve emotional abuse, it could involve physical abuse, but domestic violence. The next one I want to mention is even a very bitter end to a relationship, a bitter divorce, an end to a relationship that is really ongoing, painful. And this painful and this emotional abuse is such that we know that it will create a lowered self-esteem. It will create a lot of self-doubt. It will create a toxicity in yourself, that shame from emotional abuse. An example of emotional abuse could be as simple as, why can't you be more like your sister? Look at her. She's excelling. Look at her. She's beautiful. Why can't you be more like her? Comparisons, name calling, intimidation, bully behavior. All of this can add up to create for us unresolved trauma and set us up for that lifelong struggle in relationships, with how we see ourselves, and even career choices, how we parent, how we are in relationships, whether they're healthy or not. So, and here's a few more considerations, because we're taking the word trauma and I want us to kind of expand it and expand what it means, because trauma could be seen on a continuum. Yes, is there milder traumas? Absolutely. Over time, a repeated mild trauma can be pretty significant. Are there very sudden, shocking, and deep traumas? Absolutely. Let's say a sudden illness, a medical diagnosis that comes into one's life, a time where you may have been in an accident and there is such injury that it has really derailed your life in an incredible way. There could be a diagnosis of a significant medical issue like cancer, and that's a huge traumatic event. It can have multiple traumas as you go along. We know that there is trauma that could be from loss, sudden loss of a loved one that for whatever reason is no longer in your life. This can represent trauma. How about bully behavior? I made a good list here. Bully behavior can be a trauma, and that trauma can be such that it creates fear and anxiety, and bully behavior can make you fall into a victim role, and that victimization is ongoing in your life. So that's to look at. We know that, and I've mentioned sexual abuse and sexualization growing up is another form of sexual abuse, being treated like a sexual object. And then abuse could be done in different ways, but sexual abuse, a rape, for example, could also be part of the case. And we know that even we've seen a lot of folks going through this, but a job loss, a business that didn't work out, and it is something that really affected your sense of self and your identity. A period where there's then chronic economic hardship, and it is a huge challenge, and dealing with that. Now, here's another one. So I just am broadening our, if you will, our definition, or how we typically may see trauma, but betrayal. And betrayal is one that is very important for us to look at. Betrayal is in a relationship, from a friend, for a loved one, but it's broken trust. In fact, this creates so much trauma and pain that one of my smaller little mini books talks about recovery from betrayal, because of what that can do to us. A betrayal in a relationship creates that broken trust that can ripple into our lives, where it makes it hard to, we get full of anger and bitterness and resentment, and we can't seem to build a family of trust again, a sense of I can trust other people. Here's what we know. When we were preparing the book, Triumph Over Trauma, what we found is that at least 70% of Americans can really relate and say, yes, I have had significant trauma in my life. And when we break down by diagnosis, so the diagnosis of post-traumatic stress disorder, it's factoring right now about 1 out of every 13 individuals. Well, that's guesswork, but that's what the statistics and the data seem to indicate. And post-traumatic stress disorder is a very definite diagnosis. We first thought of that as it related to vets and military, but now we know that post-traumatic stress disorder would parallel some of the things I've mentioned today, like sexual abuse and some of the very difficult traumas that a person can go through during their childhood. And now, here's interesting. We know that right now, women, and it's probably because of the sexual abuse, but there's twice as many women diagnosed with post-traumatic stress disorder than men. So that's a little bit on, okay, what is trauma? And, trauma is not a fun word. I look at this and go, trauma. And you go, trauma is like the word depression. Trauma is like the word anxiety. It's a negative word. And this is why we say triumph. And this is why after 39 years of working in the helping professions, I can say, yes, I have seen so many, it's hundreds and hundreds and hundreds of individuals that we have seen. Actually, 39 years, it would be thousands, who I can say have had healing and recovery through working through trauma. Trauma is never anything that you can avoid. We try to. I can develop an addiction, escapism behaviors, and live a pretty chaotic, self-destructive life because I'm avoiding trauma. Or I can make the choice to have healing. I can make the choice to have a new life, a new direction. If I've had trauma, I've got to reset and renew. We'll talk about that. But we know that as you look at trauma, we always have to look at the whole person. Trauma affects the physical body, brain chemistry. Trauma affects what we may believe spiritually or in faith. Trauma affects all of our relationships. Can make us overly dependent, can make us feel like I'm not going to trust anybody. Trauma affects the whole person. And we know that as you look at this, you go, okay, what is true about trauma? And today I want to share the 10 truths of trauma. And there are 10 truths. And I'm going to hold up just a little different cover. This is the workbook. And I created a 12-week journey here on the whole area of how do I walk through this. Now, this is not necessarily just to do alone. This could be done in a group or with a clinician, but we need a plan. Hope always comes when there's a plan. And so this is why I created the workbook, and the 10 truths really is a foundation for walking through the workbook. So there you go. As we look at this, 10 truths. Trauma comes in all shapes and sizes. There's not one single definition of trauma. Oh, there's been so much written on trauma. We hear counselors these days talk about trauma-informed care. And, that can mean a whole lot of different things. You want somebody, if you've had significant trauma in your life and you struggled for a long time, you want to have somebody, yes, understands trauma, yes, understands how to get to the root cause. And for me, I want to have somebody that is on par with my faith. I want somebody that also understands just the physiology of trauma and how that can be affected. This is why we have not only psychiatric care, we look at naturopathic care. We want to see what can we do to support the body in a natural sense. And this is why we have dietitians. You want to build a whole plan that's going to strengthen the immune system, support the body chemistry, and help us walk through difficult times. That's the whole person. Now, we know that trauma can typically be very long lasting. I made a note here that you could have been a witness of severe trauma. A witness means that you saw it. Maybe you saw it repeatedly. You might have seen domestic violence repeatedly. You may have witnessed a horrific accident or somebody being killed, and that was trauma. So comes in all different sizes. You could have been just slowly riddled your whole life by a person in emotional abuse, and yet that's trauma. So remember, it takes different forms. Number 2, it's always real. We try to deny trauma. We try to say it's no big deal. In fact, we downplay it. We say, well, I was just born with this tendency to be depressed, and I'll probably always have this. So that's not the case. But we'll make up excuses when we've had trauma. And I should be able to just have gotten over this. Compared to what other people go through, this is no big deal. So that's another, if you will, a denier of the significance of trauma. So it's always real. Number 3, trauma is not a sign of failure. What we mean by that is trauma can make you feel like you've failed. It can make you feel like it was your fault. It can make you feel like somebody didn't protect me, and that could have been true, but I can stay stuck in blame. I can blame, and that will create a victimization of yourself if you stay with that, what I call a spirit of blame. So it's never a sign of failure. But so often, if I've had trauma, I take it on as some sort of failure in my life. Number 4, time alone is not enough. Time alone is not enough to get through trauma. Time alone could create a pattern of ongoing resentment, a pattern of ongoing unforgiveness, a pattern then of addiction, and a deep-seated root pattern of depression. You see, depression originates from one source, and then my body probably physiologically begins to suffer. Maybe I end up with low vitamin D, maybe my hormonal levels get off, maybe I have thyroid issues, so it begins to affect me in those different ways. And so what we want to look at is, okay, this trauma is very real, and time is not going to heal trauma without a trauma intervention of really walking through it. So many folks at first decide, I'm just going to live this way. It is too overwhelming to deal with. It is too great of an issue to deal with. It is so overwhelming that we find ourselves totally avoiding it and go, I think it's just better I just deal with the way things are now, because the fear of facing it is so overwhelming. The fear of not only facing it, but trying to figure out what to do with it is so overwhelming that we avoid it. All right, number 6, which is really my point. Unresolved trauma does not go away. If it's unresolved, it will reappear in some way. Again, time alone doesn't heal. Number 7, I can just kind of muscle through this and I'll be fine. I can overwhelm this trauma. When I feel a flashback, I'm just gonna muscle through this. Well, this becomes a form of denial. We keep saying, I'm going to muscle through this. I'm going to make it. And what happens is, no, you don't make it. What happens is, it is more and more energy to try to muscle through. And I look for a way to cope. This is where I start drinking alcohol secretly, turning to food. I'm still looking for a way to cope. So this is so important for us to look at. And number 8, there are no shortcuts to getting through trauma. Yes, are there some tools? Yes, there are. There are tools that are being used for trauma. We look at, and there's a whole list of these. And in part 2, I'm going to go through all the things that are being used to help treat trauma. But my point is, there is no magic pill, no magic procedure, no magic. And though you might hear these advertised, there's things that can come along and support us, There's things that I can learn, and I'll go through all those, but there's no magic pill and there's no shortcuts. And again, this is based upon the work that we do here at the center, a place of hope, and seeing the last 39 years, thousands of individuals who have suffered from trauma. And shortcuts typically backfire and create greater problems. But if I can do some things that create a support as I'm going through that dark tunnel with the trusted help, then I'm all for those. Okay. We also want to mention number 9. There's 10 today. Number 9 is trauma is not a life sentence. It's not a life sentence to be a victim, to live with deep clinical depression, to live with unhealthy relationships, to live with a sense of general unhealth. This is my personal belief, that God designed us to be a good creation. Again, this is my personal belief, that there's a plan. And there's a plan. It's a plan that contains hope. It doesn't mean that life isn't going to be difficult or challenging and terrible things will happen. But we can live by what I'm going to call more of a God design for our lives. And we can live with a sense of peace. We can live with joy through going through some of these things. We can be strengthened or defeated. We can live with regret, or we can renew and reset and live a different life. And that's what I believe, that there is this hope to live differently. There is a real hope. That's why we titled the book Triumph. And I could only do that if I had seen so many who have had healing and recovery. Number 10, no matter how far off course that trauma has taken you, perhaps it's addiction, and you feel like my life I'm unredeemable. I had trauma, I've created more trauma in my life, and you do feel like it's too late. I will forever have this struggle, and I want to share it today. No, it's not a forever struggle. There is a way through, and we're going to talk more about that. Remember, trauma disables emotions. Say that again. Yeah, trauma disables healthy emotions. It robs us of joy. It robs us of peace. It robs us of an ability to have enjoyment. Trauma brings us in a place, a numbness, I'm barely getting by and functioning. Trauma brings us really a lie about ourselves and who we are, who we were designed to be. So much to say about trauma, but it's the big liar. And as we look at that, we're going to talk in our next time together about, okay, here's what trauma did to us. For example, there's something called fearful avoidant attachment. Fearful avoidant attachment. And we're going to start there, and we're going to talk about what trauma has done, what it's done in our relationships, and then what we can do to move through that with a particular focus on our relationships. So this is the overview of trauma. This is the time where we pause and go, okay, trauma comes in a lot of different forms. There are 10 truths of trauma, and now I'm going to start the process of working through the trauma, working it through. Some trauma, I think we really need to make sure that we're not alone. We've probably have isolated ourselves. And what we need to do now is find the right person, find the right situation where I can, in safety, walk through the trauma, learn new skills, and experience healing. And because I've seen it over and over and over, there is hope and there is healing from trauma. And I see people do incredible things as they move through this. And when I say incredible, their whole direction of their life changes. And they feel productive. They feel a whole different sense of purpose in their life. And there is a purpose in our lives. So thanks. This is a hard topic to talk about trauma, because it can bring up, and I just want to say, this can really bring up images, memories, can bring up a lot of emotion. And that's why I say we got to be with the right person doing the right thing to help us walk through with the right processes. There is hope.